like group settings, when you have to go around and introduce yourself, you just want to throw up. You've done the basic testing for infertility. You get that phone call that everything is perfect in about the 25-30% of couples that have unexplained infertility. The question is, what does that really mean? I mean that we really don't know what's happening. There are a couple of other things that may be causing it that are not included in that initial panel, like silent endometriosis. There are some women who have the disease but don't have the typical symptoms of severe pain with their periods, so they don't think that they have it. But they could have it, and it could be causing symptoms such as infertility or pregnancy loss. There's a biopsy that's relatively new that now you can do 1 week after ovulation that can screen for this. And another possible explanation could be autoimmune disease. Normally, when you get pregnant, your body will become immunosuppressed, meaning that your immune system gets a little bit dulled, so you don't attack those cells that are not yours, that you don't recognize as the baby's developing. Some women need to have that suppression on right away when the embryo goes in. They don't get that suppression. What happens is all these inflammatory factors and the immune reagents will rise up and attack the embryo, prevent it from implanting. So you can do preliminary testing looking at some of the immune factors to see if that's a problem. They look at something called antiphospholipids, which are antibodies against the cell wall. Sometimes look at cells called natural killers. Sometimes look at cells called CD8 or CD4 cells, which are certain T cells that can be active against substances, but it's all blood testing. Third issue that can happen that we don't often test for is an infection in your uterus. Infection in your uterus. And that's called chronic endometritis. It's not an STD. It would be a bacteria that normally resides on your skin or on your body that somehow got into the wrong place. And it can sit in your uterus and create inflammation and make it hard for an embryo to implant. And you can test that with a uterine biopsy in the office. A fourth factor, an issue with fertilization. When a sperm burrows into an egg, there has to be activation factors. Sometimes an egg doesn't have the proper activation factors. Sometimes the sperm isn't able to activate an egg. Sometimes the sperm can't even bind to an egg. But these aren't things that we routinely test for in normal blood testing or in a semen analysis. Only something you can really see under the microscope when you do IVF. Usually you can do ICSI, where you take a sperm, you inject it straight into an egg, bypass it even having to attach and get into the egg. If we do ICSI and we put a sperm in an egg and it still doesn't fertilize, sometimes we'll do what's called calcium ionophore. And what that's doing is it's putting a bunch of calcium on top of the egg and sperm at the time of fertilization, and it's replacing that activation factor to sort of turn on the machinery and get things going. If these issues go undiagnosed, we're going to keep running into problems. If we're able to define the issue, most of these issues can actually be treated. It brings your pregnancy rates up to that of normal.